Morning, everyone. Thank you for being here. My name is Frederica Williams, and I'm the President and CEO of Whittier Street Health Center. Today's vaccination is very important. Whittier Street Health Center has had a long history of serving vulnerable communities, minorities, and people who have had challenges with racial and ethnic disparities in healthcare. When the pandemic broke in March, we knew, because this is what we've been doing for 85 years, we knew that the negative impact would be in the communities that we care about and the communities that we serve. So we've seen the high rates of mortality and morbidity rates. We've seen, and this is what we've done. So it was easy for us to pivot quickly and to be able to provide testing. But it wasn't only about testing, because we have a long history with the community. They trust us. We have community partners. We have our faith-based partners. We work with corporations. We work with the government to make sure that resources are brought to our community. So when testing started, it took a while for our community to trust, because we know that as Black and brown people, we've historically been guinea pigs. But with Whittier at the forefront and pivoting and also educating, we saw that between April 13 to December, we tested almost 40,000 people. And we couldn't have done it without the partnership of our community leaders and our faith leaders.
So we're here today to lead the way. And what I've shared with my churches and what I share with my community is I receive my health care here at Whittier Street Health Center. My primary care physician is here. I tell my parishioners, take the vaccine, ask your primary care physician, deal with your specific medical history, which is personal to you. Put your trust in your faith above. And that's what we're here to do. I thank you for the opportunity. We couldn't have done this without tremendous leadership of not only Ms. Frederica Williams, but her entire staff. And I'd like to give them a round of applause. Thank you so much.
We've been praying about this vaccine. I don't come to this vaccine without having skepticism and questions, especially when you think about what happened with the Tuskegee experiment and the syphilis years ago, where Black men were promised that they were getting free health care, and instead of getting free health care, they were performing a syphilis test on them. Many of them died as a result of that. And so as young boys, we understood and heard about that Tuskegee test. And I've been skeptical about taking this vaccine. And the first thing I had to do was go in prayer. Then there's a group of pastors around the country that decided they would come together. The movement was, we need to get out front because all folks are skeptical about taking this. I said, I'm skeptical too. And I went into prayer. And my members were saying, Pastor, what are we going to do about this vaccine? I said, I'm in prayer. Everyone that asked me, some of the other ministers in the city got out front. They wanted to get out front. I said, I'm in prayer. I called Reverend Bell, we're in prayer. I called Reverend Green, we're in prayer. I called Reverend Mahoney, we're in prayer. I called Reverend Higgs. We were in prayer about moving forward. And then I started reading what Dr. Martin Luther King said. When Dr. King said, science investigates and religion interprets.
I had COVID-19. I was infected back in April. Okay, and it was a tough road back then. I was actually hospitalized for about 2 weeks in the intensive care unit. You know those nightmares you see on TV of the patients in the intensive care and it's looking gloomy? That was me. With the great prayers and support, I was able to endure. Of course, the fantastic medical staff, they literally saved my life. Experimental medications, because remember, COVID-19, there is no cure. And certainly back in April, We really didn't know what we were doing, so they hit me with some experimental medications. I remember the day that the infectious disease specialist came up to me while I was lying in bed. It was probably day 11 or 12. He said, "Steve, things aren't looking so good." He could tell me the real deal because he knew I was a physician. He said, "Steve, things aren't looking real good. You're spiraling the drain." I remember he did that. And fortunately, we were able to speak medical ease. We were able to speak in medical terms, so we understood each other without going through all of the layers of emotions, and I'm scared, and oh my God, my kids, and all. No. We were able to get right to it. He said, "Steve, honestly, there's nothing out there that's going to take care of this for you. So, in about an hour, we're either going to intubate you, which is a procedure, they put a tube in your throat and they breathe for you the respirator, okay? You never know how long you're going to be on the respirator. Hopefully it's just a short period of time. So the ID doc said, you're either going to have to go on the ventilator in about an hour because you're spiraling down, or we can try a medication. Really hasn't been used in anyone with COVID-19, but we can certainly try it. It's called tocilizumab. I'll never forget that name. I can't even spell it, but I'll never forget the name. We're asking you to take a vaccination that is brand new. Maybe we need to take that leap of faith, because if we don't get vaccinated, what's the alternative? The alternative is we're likely going to get COVID-19 and all that implies. So I just want to thank you all for being who you are, setting the example, being role models for our community, and taking the leap of faith with us all. This is going to help us and help our communities.
Do you mind opening up your sleeve real quick? Just right here. Just hold that. Just hold that. Yep.
They make it look so easy on TV, don't they?
Yeah, they do. Damn quick. All right. Oh, you wanna wait? Try to relax your arms. Just relax. Just like that. Ready? Take a deep breath. Wow. Did it hurt?
No, I didn't feel it. Oh, you gotta hit it again? Oh, okay. That's it?
That's it. We're all set.
All right. Hey, Doc, we
Can
did
you
it.
take still pictures of the two of them?